We are very excited to be here today with Dr. Joel Kahn. Dr. Kahn is America's Heart Healthy Doc, and he is the founder of the Kahn Center for Cardiac Longevity. He's a graduate, summa cum laude graduate of the University of Michigan School of Medicine, which means that he's actually just a genius. And he's also a professor of medicine. He's written 4 best-selling books, including The Whole Heart Solution, Dead Execs Don't Get Bonuses, The No BS Diet, Science-Based Recommendations to Stay Healthy and Medication-Free Without the BS, and his most recent book called The Plant-Based Solution, which came out in January of 2018. He's a regular contributor to Mind Body Green, The Huffington Post, Thrillist, and many more websites. And he has a PBS special that airs all over the country about how to eat to reverse heart disease. On top of that, Dr. Kahn is also hilarious, and he's one of our favorite speakers on the subject of plant-based nutrition. So thank you so much for being here with us today, Dr. Kahn.
And let me welcome you in California and this new cannabis-free society you live in since January 1. And I'm honored to be on your very important summit.
Fantastic. All right. So let's get right down to it, okay? You're one of the smartest cardiologists in the world, period. And you have helped thousands of people all around the planet reverse heart disease. So let's start with cholesterol because it's a misunderstood topic. What actually causes high cholesterol? That's the question.
Okay, so I see your face, but it sounds like my mother talking. There's so many nice accolades. So I'm having a little cognitive dissonance, as a fancy word. So what causes high cholesterol? 2 things. We do produce cholesterol. Every human being makes cholesterol in their liver. It's a pathway that was described predominantly in 1985, won a Nobel Prize in Medicine. I arrived in Dallas for my cardiology fellowship in 1986, and Dr. Brown and Dr. Goldstein had been awarded the Nobel Prize in Medicine at the same institution just a few months before. So we were immersed in cholesterol and what are called LDL receptors on the surface. Now we know there's another receptor called the PCSK9 receptor and such. But what causes cholesterol? 1, it's the manufacturing of cholesterol, a natural process necessary for the production of steroid hormones, vitamin D, testosterone, estradiol, and all the rest. And then there's dietary cholesterol, which never is found in plants, but exists, of course, in animal-based foods of every type. And you can increase dramatically the amount of daily cholesterol your body's dealing with by eating an animal-rich diet, and you can reduce. You can't eliminate. You'll always have cholesterol made in the liver going into the bile ducts through the gallbladder if you still have one. There'll always be cholesterol in your intestines through the bile duct because of liver production. But if you carefully choose your nutrition, you don't have to add. We have no dietary need for cholesterol because we produce it. So that is where it comes from. And is it a factor in the #1 killer of men and women in the Western world? Recognizing there's countries that barely ever see coronary disease and heart attacks even nowadays. Uganda, Papua New Guinea, used to be Okinawa and the blue zones, but some of them are changing a bit because of the introduction of Western foods. Sadly, particularly Okinawa. Yeah, you absolutely have societies that don't have heart attacks. So, I mean, there is debate in the blogosphere and some in the academic world. How important is cholesterol? It absolutely matters. There's really been there's so much data over 50 to 100 years. It's hard to pick out one point. There's been a series of studies that started to come out late 2017 out of Madrid called the PESA trial, PESA. And one of the investigators is from New York City, a very prominent cardiologist, Dr. Fuster, who is from Spain. I thought he was Italian, he's Spanish. He's part of the director. And what they've done is they've taken over 4,000 bank workers in Madrid. And routinely, these people answer, I don't have heart disease, I feel fine, I'm 45 years old, I'm just a routine Madrid citizen. They do an ultrasound of the carotid, they do an ultrasound of their leg artery called your femoral artery, and they do a CAT scan of your heart, my favorite heart screening test. We'll talk about that later maybe. And they've determined that 50% of these asymptomatic people have silent atherosclerosis, most common in the leg, secondly in the carotid, and third, but still quite common, detected by CAT scan in the heart arteries. And you can just graph out the higher the LDL, the low density lipoprotein cholesterol, the higher the degree of silent atherosclerosis, down to lower LDL, the lowest degree of silent atherosclerosis. These are recent studies. Even in a group, they selected out of the 4,400 people, I think it was about 1,700 that really on paper were ideal. They ate the most vegetables. They had the lowest body weight, the best blood pressure, the best overall cholesterol. There still was nearly 40 to 50% silent atherosclerosis in the group, and the LDL cholesterol tracked so closely. So cholesterol matters. You've probably heard Dr. Esselstyn say a cholesterol around 150 or less is part of the bulletproof guarantee that his very evidence-based and strict program, but wonderful program that I endorse heartily and teach in Detroit, can provide. You don't want, I'll tell you, I had 2 patients today. One has a cholesterol of nearly 300, and I was able to determine has arteries much younger than his age. I see people with a cholesterol 300 have advanced. So there's more than cholesterol, but never, never believe a blood cholesterol that's elevated doesn't matter. It may be the single and only factor that puts you prematurely in a cath lab or worse. There are other factors. There's something called your lipoprotein A, which is cholesterol. It's just not routinely checked. And everybody listening, please ask your doctor for a simple, inexpensive blood test called lipoprotein A or LP(a). It's the reason Bob Harper, Biggest Loser fitness trainer with Jillian Michaels, claims is the reason he had a heart attack in February 2017, because he never had it checked and he was sky high and it clogged his arteries up despite a lot of fitness and a little bit of bulletproof coffee, which I know he has now stopped, thank God. Inflammation is the other factor, and this does tie into diabetes and nutrition, of course. We know that it's not just cholesterol. It's cholesterol plus 19 other factors, but the big elephant in the room plus cholesterol is inflammation. And if you have certain conditions, rheumatoid arthritis, lupus, arthritis, psoriatic arthritis, psoriasis, colitis, Crohn's, ulcerative colitis, inflammation, and you can measure it with that simple blood test called the high sensitivity C-reactive protein, and many other blood tests nowadays, getting better and better and better. If you have inflammation and these chemicals that are circulating in your bloodstream every day, they can also impact your arteries adversely. We had a big trial presented in November 2017 called the CANTOS trial, proved without a doubt the theory, even if your cholesterol is low and your inflammation's up, that alone, it participates in hardening of the arteries. And if you lower inflammation, in the CANTOS trial, it was with an injectable drug every 3 months. It costs about $200,000 a year. Not a very practical thing when you can just eat broccoli, sprouts, mangoes, and chermoula. But anyways, it proved the point that lowering inflammation does actually impact atherosclerosis and events. So it's more than one thing, but never, never believe the cholesterol naysayers that cholesterol doesn't matter. You're just lucky if you have a high cholesterol and good arteries.
So another thing that you talked about here is the fact that LDL cholesterol may be the single variable, the most important variable in determining your risk for heart disease. Now, in the blogosphere, there's a lot of confusing information about the fact that the only type of LDL cholesterol that matters is the small, dense LDL, and that the large, fluffy LDL, in fact, is not dangerous and it's actually protective. True or false?
It's false. So there's a couple layers you got to get through there, and I'm reaching over. Number one, 90% of people don't have those particle subtypes measured on a routine doctor's cholesterol panel. If you go to a health fair, if you're in a corporate wellness program, you're getting cholesterol, HDL, triglyceride measured, and LDL, the single most important predictor, is actually a calculated number. And particularly if you're overweight, pre-diabetic, metabolic syndrome, it's very fraught with error. You have to, and this is not a commercial statement, I don't own Cleveland Heart Labs, recently Quest Labs bought them. You have to do advanced labs. This is just one example. There's one called Boston Heart, there's one called True Health. Your doctor or you maybe can go to the web and find a place that offers advanced labs. You have to get these advanced panels or you'll never know that. So the majority of people don't know it. If you have the advanced labs, all cholesterol LDL particles are atherogenic. And generally, if the small dense LDL is up, the large fluffy LDL is up, the single most predictive number, it's called the LDL particle number, LDLP, which is only available on advanced labs, not available. It's $40 test. There's no reason anybody can't go to their doctor and say, I want one of those advanced lipid profiles so I know what my LDL particle number. That is the single most predictive measure you can make of atherogenesis. Even Dr. Lard, who's Dr. Lard? Well, I didn't come up with that name. That's a name that John McDougall gives to Dr. Ronald Krauss, who's in your neck of the woods, Dr. Cyrus. Ronald Krauss is in Oakland, California, as the director of a lipid lab. And I've never met the man. I'm quoting the esteemed Dr. John McDougall in that title. Dr. Krauss has argued vigorously about this small dense LDL is the atherogenic form, and it's the only one that mattered. And when you eat coconut oil, it may not raise your small dense LDL. Dr. Krauss published a paper in early 2017 that actually his own lab disproved that small dense LDL was the only harmful particles. I think it was a dairy study. And dairy raised cholesterol, dairy raised all the particles. And he backed off and actually made a statement I thought was pretty shocking for him, that all LDL particle types are atherogenic. Some may be slightly more than the others, but when you approach lifestyle, diet, exercise, stress, sleep, weight, environmental issues, love, marriage, hugs, you actually probably are going to improve all your LDL particles.
Excellent. Okay, so many people in our audience have hypertension and on blood pressure medication. So how can people reduce their blood pressure via diet?
Yeah, so probably, and I'd encourage everybody, I don't know if you've done this, read the book Presto by Penn Jillette, famous for Penn and Teller. Penn Jillette was on 6 prescription drugs and was going to die before he hit 60 of hypertension, most likely, till Dr. Furman got to him, a nutritionist that is working with Juliana Hever, Ray Cronice got to him. He calls him the Cray Crow. It's the most amazing book, Presto, about using a plant-based, no oil, high carb diet. And he was able to reverse his diabetes very quickly. It's weight loss. And when you bring down that visceral fat, when your waistline, in his case, went from 44 to 36 in 3 months, it's a very aggressive protocol he talks about. And I've seen it with my patients using generally whole food, plant-based, high carb, no added oil, no SOS diets. You can use fasting mimicking diets that Dr. Longo in LA teaches. When you lower visceral fat, you will see blood pressure come down. So it's hard work, but it's just food. Get over it. It's just either skip some meals, change what's in your meals. And I can't tell you how utterly interesting that book Presto is. It's not a brand new book. It's a little over 1.5 years old, but I had missed it until recently. And it is so dirty that you'll snicker all the way through it. You should read the chapter on Joel Fuhrman. I talked to Joel Fuhrman today. He never read that book. He's got a whole chapter on Dr. Fuhrman, very complimentary in a Penn Jillette world, as the Penn Jillette world is all about F-bombs.
Okay, so you mentioned this, it's about losing weight, and that can take time. So in general, what can somebody expect? Like, how quickly can somebody get off blood pressure medication, lower the medication? How does that process go?
Yeah, so the weight loss is, in most cases, fairly gradual. We talk about a couple pounds a week. That's 100 pounds in a year. Penn Jillette talks about doing that in 3-4 months under careful guidance, and nobody should do that without medical supervision at True North or even on their own, but with their medical doctor. We know that there are some foods that particularly favor low blood pressure. We know that hibiscus tea. We know that eating leafy greens and beets, which promote extra nitric oxide production through about a 12-year-old pathway we didn't know before that's involved with chewing leafy greens, beets and beet greens, drinking beet juice, getting them on your tongue, letting them interact with these little bacteria to make more ultimately nitric oxide. Don't use Scope. Don't use Listerine. I hope they're not sponsors of this podcast because they kill those bacteria in your mouth. There's data. I don't know if you know this, Robbie and Cyrus. A few years ago was shown if you use antibacterial mouthwash, if I eat Robbie food, a bowl of kale and beets, and my blood pressure will go down because I'll produce more nitric oxide within a couple hours. If I use Scope, Listerine, or other antibacterial mouthwashes and eat greens and beets, it will not go down. So it interacts adversely with normal blood pressure from plant-based foods. It was just reported in late 2017 that the risk of developing type 2 diabetes may go up 50% by the chronic use of antibacterial mouthwash. So throw that stuff away. Don't put it with vodka as a tonic and drink it. Let's get rid of it and just brush your teeth, water, pick, floss, or maybe find something that doesn't have antibacterials. So the power of beets and greens, Ground flaxseed, couple tablespoons a day, which we all should be doing, can lower blood pressure. So there are those foods. And watching salt. I mean, there's no doubt the no SOS diet matters for people with difficult blood pressure. But can we get everybody off blood pressure medicine? I don't think the answer is 100%. It's a complex. It's called polygenic. There's genes, there's environment. You better check yourself for sleep apnea and get a sleep test if you snore, if you stop breathing, because until you correct that, you may not control your blood pressure. So, you know, a lot of these issues are a kind of multi-pronged, but they always center on the plant-based no SOS diet as the core nutritional concept for sure.
Now, one of the things that we see a lot, and that I know a lot of other cardiologists see, is that when somebody transitions to a low-fat, plant-based, whole food diet that happens to be high in plant, carbohydrate-rich foods, sometimes they see their blood pressure go down, their cholesterol go down, their body weight go down, but their triglycerides goes up. Why is that happening?
Well, number one, let me just say, it shouldn't concern people. And the proof concept there is in the kind of landmark study by Dr. Ornish, the Lifestyle Heart Trial, initially published in 1990, and then a larger follow-up in 1998. Very prestigious peer-reviewed journals, Dr. Dean Ornish of Sausalito, California. Despite the fact that in his patients, HDL went down and triglycerides went up on the diet you just described, so did the reduction in coronary stenosis go down. So the goal is don't have a heart attack, don't have a bypass, don't have a stent, don't drop dead, and get cleaner arteries. That all is occurring while your HDL drops a bit and your triglycerides go up. You know, I think it's variable. I don't see much triglyceride elevation in those that can do that diet and achieve a more optimal weight. I think if you're kind of stuck at a weight level, you got to ask why, and your triglycerides may hang high at that level. I just simply wouldn't worry about it. Omega-3 deficiency may be part of it. You know, omega-3 supplements, whether they're called flax seeds, chia seeds, hemp, algal-based omega-3 oils, all will lower triglycerides. Green tea lowers triglycerides. So I try and use natural things, but I don't see much triglyceride issue.
So you are incredibly knowledgeable about all the best tests to take. And one of them is a coronary calcium test. So can you explain what that is, why it's useful, and just what you think of it?
I forgot to use a prop. 5 pounds of visceral fat around your belly. You should feel how heavy this sucker is. So if you say, you know, it's early 2018 and part of my resolutions, it's, you know, maybe a month ago, but part of my resolutions is weight loss. You know, this is what makes inflammation. This is what drives triglycerides up. But this is also what goes away with the educational program and nutrition program you guys teach so well, which is critical. So bring it to California, although I know people are going to be watching this all over the world. You know, tragically in December 2017, a 40-year-old, Jonathan Feldstein, who was, you know, Maroon 5 Adam Levine's manager. I mean, the guy probably had a pretty cool job. I'd like to hang around Adam Levine. You know, drops dead of a heart attack, no warning. I mean, sad as can be. And that's just one story of so many people that this happens to. So how can we identify? How can, you know, I had a 42-year-old in the office today whose father at age 56 had a heart attack. He was kind of misled. He's been eating 3 eggs for breakfast and steak for lunch and turkey for dinner, and he kind of got on, you know, cheese. Had a, you know, smack him around with the forks over knives DVD today a little bit that he'll go home and watch today. But, you know, he asked the question, so, you know, Dr. Kahn, how can I be sure that I'm not on that path road to my father's heart attack in his early 50s, or maybe earlier, because his diet was, you know, clean. He totally bought this grass-fed, organic, free-range bull, you know, crap. So, you know, how can you know? You look at the heart arteries. How do you know? Why do you rob banks? Because there's money, you know, in the bank. That really sucks. So this CAT scan was developed in San Francisco, again, right there in Cyrus's backyard. Anybody who has some time after the summit, there's a Netflix movie called The Widowmaker that talks about the history of the development of a CAT scan that everybody can sign up and get at age 40 or 45 or 50, or 55, 60 if you haven't had it. In my town, it's $70. You lie on a CAT scan table, you hold your breath, and you go home. No IV, no iodine. Your kidneys can be good or bad. You can't be allergic to it. And if you have known heart disease, don't get it. If you've had a stent or a bypass, you don't need to answer the question, do I have heart disease? But if you're a free-range human making the assumption that I'm healthy $70 for a test that has the same radiation dose as a mammogram is a very good choice. I'll tell one other thing. There's a old-fashioned sign called the diagonal earlobe crease. Since everybody's kind of watching this at work or at home, get out a mirror and look at your earlobe. And if you got a real deep line, that doesn't come from wearing heavy earrings or something, that is an old-fashioned sign that you might have silent heart disease going on. It was ignored for a while, but it's come back in the last few years. It's about 70% accurate for predicting the presence of silent heart artery blockage. Diagonal earlobe crease, DELC it's called in the internet. Just Google it, you can see a picture of it. And if you have that, go to your family doc and say, hey, I want my advanced cholesterol, I want my particle numbers and all that stuff, but can I pay $100 and go to some local hospital and get this CAT scan of my heart arteries? That is the simplest, safest test for that. I've been involved in thousands and thousands of patients with these calcium scans. And there is no better way, and this is the American College of Cardiology and other august societies agreeing, it just hasn't entered mainstream, which is actually causing people to die unnecessarily, sadly.
It's fascinating. Yes, I've seen the Widowmaker movie, and I can't recommend it enough. It's very, very informational.
That's Hippocrates, primum non nocere. First, we must do no harm. So we have to go for accurate diagnosis. As long as I have Hippocrates here, because this was a Christmas present from a patient, Hippocrates' oath says, I will apply dietetic measures for the benefit of the sick. So I just want to know how old this concept is. It doesn't say anywhere, I will use pharma, surgery, and ignore nutrition. So this dude is so cool. He sits on my desk now. I love it.
That's awesome. Okay, so you are a prolific writer. You're on blog posts all over the place, Medium, you contribute all over the place. And you have written several articles about better sex and how foods promote blood flow to your genitalia. And this is obviously a very important topic. We have millions of people suffering with erectile dysfunction and poor sex drive, and people who don't know how to solve that problem. So can you talk to us about blood flow and how food affects people's sex life?
Absolutely, and I'll just do a shameless plug because I so much appreciate you and Cyrus. I've actually written 5 books, and the one Cyrus didn't mention is called Vegan Sex, which was co-authored with Ellen Jaffe-Jones and Beverly Lynn Bennett. It came out in 2017. It's actually coming out now with a formal publisher in 2018. I'm excited about. It's a hardcover book, of course. It has to be. We're talking about, it's like, I wanted a vibrating spine, but they wouldn't do that for me. So we know more about this in the male physiology. Let's call that an erection, because that's what it's called. And we know that that is a tremendous amount of blood flow being shifted from other places to the groin, and it causes the arteries to get dilated. That actually, it's very cool. When that happens, it smashes the veins collapse so that the blood can get in and the blood can't get out, which is a very cool system. Talk about engineering genius. And why do you get that rush of blood flow? Well, you need healthy arteries that are not clogged up with atherosclerosis, inflammation, high LDL cholesterol, lifestyle, smoking, and nutrition. And we also need the lining of arteries, and that's an important concept. Inside every artery that's shaped, I have a little model here I don't see, I won't go grab it. Inside every artery is a wallpaper lining called the endothelium that makes this magical gas called nitric oxide. And if you have healthy arteries and you're eating greens or you're eating beets and you're not eating sausage, egg McMuffins and donuts, which absolutely destroy your endothelium, saturated fat from animals destroys your endothelium. Dr. Robert Vogel, a cardiologist in 1996, did a study. If you feed a person a sausage, egg McMuffin, within 45 minutes, the lining of their arteries, their endothelium, stops making nitric oxide, stops dilating. Not a good thing to eat before a date, guys. Go to a salad bar before a date. So you got to get the junk foods out, put the good foods in. Nitric oxide production won the Nobel Prize 20 years ago this year. You will have a massive and successful erection, and you can augment that with lifestyle by avoiding atherosclerosis. You're probably more worried about stroke or heart attack, but truly be worried about erectile dysfunction. And also, just like the diagonal earlobe crease, a guy in his early 40s, mid 40s, early 50s, starting to have erectile dysfunction. Woo, 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 alarms are going off. You might have silent heart disease. Go get checked. Get that heart scan. get, a real inner look at your arteries with somebody who's a specialist. So nutrition is big, big, big. So what can you do? Eat more greens, make more nitric oxide, stop using antibacterial mouthwash, some of the things we talked about with high blood pressure, because they are related. Are there special foods? Well, if you like to put powders, maca powder may have some value. Trying to think of other, there's these crazy things, horny goat weed and all. They actually have a little data behind them. But eat whole food, plant-based, no SOS diet, and you will be optimizing the chance you're going to have successful sexual encounters that bring joy. Be careful, might bring children.
You've mentioned several times a no SOS diet. Can you explain what that is and why that's important?
Yeah, and that's giving a shout out to a lot of people from True North and Chef AJ, but salt, oil, sugar. It's just an easy way to describe the difference between a vegan junk diet, which has advantages for the environment, has advantages for animals, and could still be healthier than a meat-based junk diet. But we learned there was a big publication in a major cardiology journal about the middle of 2017 from Harvard School of Public Health, that in general, people that identified a plant-based diet as their eating pattern had better health and survival than people that didn't identify a plant-based diet. But those that actually described their plant-based diet as more of the junk food, it didn't have whole grains, didn't have fruits and vegetables, had higher amounts of alcohol and sugar, actually didn't do as well as the baseline group. Those that describe their plant-based diet as what we call a no SOS, lots of fruits and vegetables, whole grains, legumes, not added sugars and oils, actually had a tremendous reduction. So a healthy plant-based diet is really the goal, not just any plant-based diet. So salt, oil, sugar. Nobody loves sugar. I still think added fats and oils are a bigger issue in this obese society, but they're both issues. But it's so SOS is just a simple way when you look at, are you going to dump olive oil all over these gorgeous bowl of vegetables, which naturally have nearly no fat in them? They have as much as we need, but nearly no fat. Warning, you don't need it. And like we said, you don't need to add cholesterol from animal products or necessarily extra saturated fat from even plant-based sources like oils of previously whole foods.
I love it. This is great. Okay, so here's a question we love to ask a lot of people, okay? What's the number one challenge that you see people face when it comes to lifestyle change? And what do you recommend for overcoming this problem in particular?
Yeah, I actually think the biggest challenge is knowledge confusion, dietary confusion, headlines. If they're on the internet, you can get a different message every day, different messages from their medical team, their nurse practitioner, PA, health coach, physician. Turn on the TV and you see the bone broth message of the day or the collagen animal protein message of the day, protein, which of course is Dr. Garth Brooks' favorite topic. Garth Davis. Yeah, Garth Brooks is awesome too, but Garth Davis is much healthier looking human being. So I think they're confused, and so I've got to give them education, because I think there's willpower and skill power. That's a term David Katz uses. You not only have to identify they want to make change, and you got to give them some skills, but first I got to get some knowledge on them. So that's where I just use forks over knives. I use What the Health. I use PCRM. I actually now have a plant-based health coach online system I'm using in my office. It's very cool, and patients get daily text messages and daily articles, and a health coach call once a week, all plant-based, all very up and up. So you gotta kind of pound them away from that common culture that leads them to believe eggs are back and cholesterol doesn't matter, and dietary cholesterol is no longer a measure of concern, and there's that confusion out there. And this guy that came in today at age 42 with a father with an early heart attack, I've got to turn that ship around to what he's been doing for 4 or 5 years, and I've got to start with just getting him to buy into that. Maybe he hadn't been hearing this from credible people. As I say, some of these tools that are out there are so wonderful. Then I can sit down and pick some small goals. Let's get off dairy. There's every substitute in the world, not all of them healthy, but every substitute in the world. You no longer need to drink cow pus anymore. Then maybe up fruits and vegetables, simple goals, a salad a day, an apple a day. I don't mind people using meat substitutes short term. Actually, this young guy, I kind of was pushing him on a Beyond Meat burger, just first time in his life, try a non-beef burger. I want him to get to beans and whole foods as soon as possible. But, you know, changing 42 years of culture and lifestyle, I'll take baby steps unless they're very, very sick. And then I'll want to immerse them very quickly otherwise.
So Dr. Kahn, that's actually a brilliant response, because there's a lot of other speakers who have mentioned the same thing, which is that there's too much information. There's too much information on the internet, and it can be very confusing to understand exactly what to do, especially when you go to, you go to Google and you type in how to eat for improved health, how to reduce cholesterol, and you get bombarded with multiple different people saying multiple different things. Now, the main difference between what you find on the internet and then between yourself and us is that what we do is evidence-based, right? That's what Mastering Diabetes does. That's what you do. And it's very important for people to understand that if you're following information that's not evidence-based, you're likely to run up against hurdles into the future, and you can actually decrease your quality of life overall. So that's a very long-winded way of me saying thank you for doing what you do. Thank you for writing books. Thank you for taking the time to research. Thank you for translating it for people to understand. And thank you for going around the world and talking about this and really educating people. What you're doing makes a huge difference, and we genuinely appreciate you from the bottom of our heart.
Thank you very much. And just eat an apple a day, boys and girls. Start there and don't give up on it. Yeah, it is. And, Dr. Steve Nissen, the head of cardiology at the Cleveland Clinic, is like one of the worst influences on this movement because he ridicules it in the New York Times. I think he literally said the fanatic vegans in some article in late 2017. It's a problem. That's why they run and confuses the public. And we had another example like that. But you're right. Evidence-based says fruits, vegetables, legumes, and whole grains with minimal or no added oil, salt, and sugar will have the greatest likelihood of causing optimal weight, blood pressure, cholesterol, sexual performance, health, longevity, lifespan, and avoidance of disease. And it's delicious. We love it. I've been doing this for 40 years. I am very grateful for being introduced to this dietary lifestyle very early in my life.
Awesome. Thank you so much for joining us.
I appreciate it, you guys. Peace, and keep up the good work. You're really changing and transforming health throughout the world. Thank you.